kinds of lifestyles and behaviors. Economy, community, and then lifestyle again, as it's determined by the individual. So, usually in public health, we talk about different diseases, disorders, and risk factors, and among the dominating public health issues today are non-communicable diseases, NCDs, where the four dominating ones are cardiovascular diseases, chronic pulmonary diseases, diabetes, and cancer. And we talk about 60 million premature deaths annually, premature meaning before the age of 70. Mental disorders are another big issue that we need to deal with. Health inequalities, autoimmune diseases, and then we come to the risk factors that are connected to lifestyle. I mentioned these, there are obviously other public health issues, but those are the ones that are mostly relevant for me and relevant for us who are interested in looking at the environmental impact on public health. Those are a little bit the kind of health issues that I will also tap in today during the talk. Then in environmental health has traditionally and in epidemiology been traditionally working quite a lot with threats to health, the negative, the harmful exposures from the environment, such as pollution, air pollution, soil, water, waste, etc. Noise is another increasing issue in the urban environment, especially with increasing traffic, industry, etc. Heat, especially the urban heat island, as you know about, is also another factor that is expected to increase with climate change, and then the increased morbidity and mortality in relation to heat-related diseases. Climate change, as said, is considered the major health threat globally today. Environmental degradation and biodiversity loss is connected to this global challenge. Also, those environmental health threats and risks that I've listed here are somehow related to the topics I will talk about today and the green spaces and natural environment's effect on health. But there are other threats, of course, that we can discuss. Yeah, just to show you a few of these, I was just into, these are just a couple of slots I got from, I was into The Guardian this week, and they come consistently, the different threats we see from environmental degradation and climate change, etc. So the UK government plans for more extreme rainfall. The new plans more or less everywhere. This is just funny because this is just an extraction of a few of the notices from this last week. Toxic air pollution particles found in human brains. We discussed that yesterday with David Patrick. There was also recently a report that was based on the recently published article by Mayher et al. And his colleagues. The funny thing was that some in the comments, more or less entertaining comments, which sometimes my eyes fall on those. And this one, this is a little bit showing the irony, but they haven't proven the link to Alzheimer's yet, these particles reaching the brain. So we don't want to rush off and clean up the air. That would just be making the world a better place for no reason. I will come back to this statement a little bit later because it has certain implications for what we work with and how we can approach these issues if we want to take research into policy and action as well. Another example just from this week, soaring ocean temperature is the greatest hidden challenge of our generation. We get a lot of these advertisements that, this greatest challenge, the major global threat, etc. And this was just one of those, and they are showing with one of those graphs what has happened the last century. Because the oceans, the water, trap the temperature increase. I read that if it weren't for the waters, the sea across the globe, the ambient temperature would have increased with 36 degrees by today, rather than the 1 or 2 degrees, which has increased due to climate change. So it's kind of an important source, and we need to maintain it before it reaches its threshold. Right, another one also from this week, globally significant wilderness areas, which we are also destroying in this anthropogenic era, which has now officially been denoted as human beings our behavior have actually had such an impact on the global environment and the global climate that it warrants an era of its own, unfortunately. Humans have destroyed a tenth of the Earth's remaining wilderness in the last 25 years. That's the sad thing. It has been within a very short time, and there may be none left within a century if trends continue. All right, this may all appear a bit distant, peripheral to the work which I might be a little bit closer to, or have been closer to, the green spaces and the health promoting and disease preventing effects of urban green spaces. I will try and kind of connect those topics a little bit more during my talk. Healthy environments, if we look at it from a different side rather than the harmful effects, exposures of the environment, and try and look a little bit at what we can do to improve, protect and improve the health, the public health of today. I was to the annual conference of the International Society of Environmental Epidemiology last week in Rome, Italy, and it was I didn't make a systematic review of the program, but I think that 75% was about air pollution, and what I tend to feel is that it would be encouraging to look a little bit more on the solutions, or rather that we could kind of work more together, because that knowledge on the air pollution, harmful exposure and the assessments is crucial, of course, to understand what we can do to protect health and to decrease the air pollution. All right, in the UN Sustainable Development Goal targets, it says, one of the paragraphs says actually that by 2030 we are aiming to provide universal access to safe, inclusive and accessible green and public spaces. So, you know, this little thing has seared into the bigger documents. And also the Parma commitments from 2010, where the European WHO countries, member countries, committed themselves to provide healthy settings of daily life in which children can walk and cycle to kindergarten and schools, and to green spaces in which to play and undertake physical activity. Right? So, the things that we often talk about when we talk about green space prevention, the urban green space prevention mostly, or that is what I have been working with predominantly. We talk about mediators, pathways between access, exposure to green spaces, and then we often talk about stress reduction, which can be promoted by exposure to green space, increased physical activity and improved social capital, social cohesion and the sense of community within a neighborhood. Then we talk, those could be listed as cultural ecosystem services, but if we talk about the regulating ecosystem services, which tend to be looked at a little bit more objectively, at least they may be perceived as easier to monitor, then green spaces can have an effect on heat, reduced heat stress, etc., and a certain effect potentially on the diffusion of air pollution, and also reduced noise perception. All right? So just to give you a few examples, I mean, all these pathways, all those mediating factors, there's been done quite a lot of research, and there has been exponentially increasing, I would say, the research, the studies within this area, where the latest 5-6 years maybe has been coming increasing amount of better quality studies, where we have actually been able to show that there are effects on stress, etc., physical activity, and the other pathways which we're looking at here. I will not be able to cover all those, but I will give you a few examples. For some reason I will focus on my own research. We made an experimental study where we looked at stress reduction. That was the outcome we were mainly interested in, and we exposed our test participants to stress. They got a stress test, so they were all experienced increased levels of stress, which we measured by self-reports, but also with biomarkers such as heart rate variability, breathing, and cortisol in saliva, the stress hormone cortisol. The main outcome of this study was that there was an effect by exposure to nature. And as you see, this is a kind of blurry picture because we did it in order to keep it a standardized, more easily monitor, an environment where it was more easy to monitor and see exactly what components of nature we were looking at. We did this in a virtual reality laboratory. So they weren't really exposed to real nature, but it was just an animated screen or within a room where there was animated disposal of natural scenes. And we also had the sound of nature to make it a little bit more real within that setting. The reality feeling, the presence feeling should be increased through that. And as you can see from the graph, we got an effect on the heart rate variability, which is indicating an improved parasympathetic activity response in the group that was recovering after the stress from now I shall use this one, from the virtual nature with nature sounds as well, as compared to those that were just in the virtual nature but without any sound, or in the controlled group. Right, we can discuss this another time. But in brief, we saw only the effect, as I said, in the group that got nature plus sound. And our idea, our hypothesis around that is that it wasn't a realistic experience enough in the group that didn't get the sound as well, and some of them perceived it almost weird that it was such a realistic visual impression but without any other sensory experiences. Yes, we have done a follow-up on this study where we look at only the effect of sound. Okay? No results from that one yet. We have the data but we haven't analyzed it. And this is a study where I've unfortunately not been involved because this is very interesting to me. I used to work as a radiologist. Oh, I forgot to present myself before.
My fault, really.
I used to work as a radiologist before in Sweden, so I have a medical background. Anyhow, this slide demonstrates a study. It gives us a picture of a study that Bratman and his colleagues published in 2015. They had done a study where people were either having a walk in a built urban environment or a walk in a green setting. And they were measured by I'm so used to using my hands, but I'm using this now, or my arms rather. So they were looking at rumination, which is kind of a behavior, a thought process that we use, or that we are inclined to dwell into when we're getting more and more, if we are getting depressed. So it's kind of a symptom of depression that you kind of stick into negative thoughts, which I guess goes into a vicious spiral. All right, so they asked these people after the walks, and those people, we have a tendency to be a little bit like that in general. So they looked at from a baseline what happened to this rumination behavior. And they found that those that had a walk in the nature got a decrease in the rumination tendency, while there happened nothing to those that were walking in the urban setting. Thus, go to the park rather than the shopping mall. They made a sophisticated fMRI experiment also on this group of participants. So in this one they could show that they got a decreased activity in the subgenal prefrontal cortex here, where there is that is kind of the activity center for this rumination, for the stress effect that we can perceive by being more on the depressive side of life. Anyhow, as you can see from the graph, that area got a decreased activity as compared to the so-called urban group, where they got an increased activity, kind of in a structural, biological way, also demonstrating the effect, which was not only self-reported thus. Okay, so we have this effect on stress, and that can be relevant for many different disorders. It's a risk factor for example, cardiovascular diseases, but I guess that it's most oftenly related to mental disorders, and this was looked at in a longitudinal study done by Ian Alcock and his colleagues in England, where they looked at population health data from different panels, and they looked particularly at those population, the part of the population that had moved from baseline, where they start with the measurements, to the study to a green area versus to a less green area. And as you can see, those that moved to a greener area got an improved level of mental health that was measured by GHQ-12, and as compared to those that moved to a less green area, where initially they got a decrease in the mental health levels, although it returned to baseline after a couple of years. The worst you can do, I've told this before, but probably not to some of us here, is that the worst you can do if you want to decrease your mental health is to get children. Then you go down like this, you go down even further, and you remain down here. That was also, I was there when they were looking at this data, and yeah, I was a bit surprised first, but I guess it's related to the worries and the eternal concerns you carry when you have children. They can also be nice, actually, to have. All right, physical activity. I talked about stress and then physical activity in relation to urban environments. This is the most recent study, I think, that has been published on the topic on built urban environments, neighborhood environments, and the relation to physical activity. It was published by Salis and his colleagues in the Lancet this year. So they were looking at a global sample, international sample of cities, 14 different cities worldwide, where they had data from almost 7,000 adults. And they looked then at different environmental features that had an effect on the variability in physical activity in this population. The 4 factors that came out as having an effect on the variability was residential density, intersection density, transit density, and finally number of parks. Otherwise I would not have included this study in this talk. What you can see is what is usually found is that the number of parks, the green factor, has the least effect, but it actually has an effect on the physical activity guidelines. What they looked at was those environments that had the least of, in this case, number of parks as compared to those that had the most, and looked at the difference in meeting the physical activity guidelines. So there was a 14% difference between those that had the least versus those that had the most. I have not done any particular population study on that that is related to health, but I was working with WHO in relation to this PARMA commitments that I mentioned before, where they want to monitor, of course, the member countries' commitments and whether they live up to the recommendations. And they were interested in, as I said, that accessibility to green spaces were mostly related to the fact that children should have a chance to become more physically active or be more physically active. So we were developing a GIS-based method and relating that to population data. And this method can then be applied in different cities in Europe, obviously also in Canada and North America, but it was developed particularly within a European context. So the urban green space indicator, UGSI, is obviously depending on the distance to the green space you are measuring, as well as the size of the green space. If you have a larger size, fewer people in the urban population has access to that larger space, as well as if you have it more nearby, it's also a lower proportion of the population that have access, obviously has access. I thought I would show you a little bit about the GIS data we use, because I was to a seminar the other week within the Faculty of Forestry, where I understood that there is no particularly well-developed land use cover of Canada, but in Europe they have this project. That's what I understood, because they had been doing this fascinating thing where they had determined themselves and made this classification of different land use areas within the city they were interested in. And yeah, there is a European project, it's EU-based, so it only covers the EU countries. It's called the Urban Atlas, where they have used mainly satellite data, Earth observations, but also soil sealing degree and field observations, etc., to make a classification of the urban areas in Europe. And this is just an example of how Brussels look if you go into the Urban Atlas, and that is free for use if you're interested in working on European cities. Anyhow, the thing or what it can be useful for is obviously that the classification based on these Earth observations, but also field observations, etc., is categorized into different classes. You cannot see much from this blur picture. This shows the total matrix. So this is a little bit better resolution of the picture. It doesn't show everything, but at least it shows the green urban areas. So you can see, so these are construction sites, airports, support areas, railways, etc. So this is kind of how it is divided into different classes. And this is what we use for the WHO Urban Green Space Indicator. The green urban areas is then, because each of these classes are defined, if you go into the Urban Atlas guidebook, you can find the different definitions for each of those classes. And the urban green areas are areas that have been defined as being for recreational use, and they shall be of a certain size, so it's not these minor little plots of vegetation which you can find in the city. Private gardens are not included. It's supposed to be for public use, for recreation. We can talk about whether that is, and also cemeteries are not included, and that could have an impact on if you're talking not only about physical activity and stress, but if you talk about more general ecosystem services, then it might be of relevance to include also those private and other areas where it is green, although it's not public. Anyhow, for the purpose of the Urban Green Space Indicator, it made sense because that was aimed for physical activity. Yeah, this is just because we made it in Malmö, the city in Sweden where I used to live close by and nearby, and then we also did it in Kaunas and Utrecht in the Netherlands, Kaunas in Lithuania, and looked at different sizes and used different methods to look at the kind of results, what we got for the, and as you see, with a very small urban green space of 0.25 hectares, almost 90% of the populations in Malmö and in Utrecht that have access to that kind of small area within 300 meters, yes. A bit fewer in Kaunas, although in Kaunas, as you can see, it's a fairly even distribution, so they have access to fairly much larger, relatively larger green spaces as compared to in Utrecht and in Malmö. I'm not today going to get into discussion of all the limitations of this method. There are millions of limitations. The point with this one, as I see it, and when we published the paper around it, and the report that will come out of it, is that it brings into the public health agenda that green spaces, that nature has an impact on public health, and therefore it's important to monitor it. Yeah. Health inequalities, stress, physical activity, and health inequalities, as I said, are major issues that we need to deal with. Mitchell and Popham published in the Lancet in 2008 a major population study of 40 million English people, looking at mortality and the incidence ratio depending on the green space vegetation cover in different areas of England. And what they found was particularly this interesting thing that, as you know, depending on socioeconomic status, you have there is an inequality, so that you have a higher ratio of mortality in populations with a lower income. For example, this is the income graph. And what happens when you move from a less green to a more green area is that this gap decreases. So it seems as if the green space has some kind of buffering effect, or as you can see, it has a certain health effect which is more pronounced in a deprived population, which could be of interest. I will show you another study. It could be of interest for urban planning and where to direct your resources, etc., in green space management within cities. I am part of a European project, Green Search, where we were interested in using on the European level the WHO Urban Heart tool, the Health Equity and Assessment and Response tool, which is mainly developed for developing countries, but we wanted to look at it at European data cities. This Urban Heart tool uses different indicators of inequalities, social and environmental health indicators, determinants which are related also to health inequalities. And you can see for social and human development like education and immunization, etc., but also unemployment and the governance on a more major scale. And looking then at these health outcomes which are most strongly related to inequalities. Infant mortality, diabetes, tuberculosis and road traffic injuries are all strongly related to inequalities. What we were obviously interested in was whether it would improve the tool by including green spaces here in the physical environment level. This is just an example of the kind of matrix you get out if you use the Urban Heart tool. It's a fascinating tool. I recommend you to look into it. You can find it very easily on the WHO website. Because it's also interesting, for example, what they use is they obviously use, the cities are supposed to use available data, and if there is an indicator like this one that is not even available, in District D here, this is all intra-urban inequalities it's looking at. So in District D, there's not even data, which is kind of the lowest indication you can get. Otherwise, they use this thresholds with using the city average and the national targets. So you can also look then at national inequalities, intranational inequalities. So this is kind of the matrix you can get out of that. And whether that matrix could be improved by adding green spaces or not, that could be of interest. We made a case study in Berlin, which was suboptimal because Berlin happens to be one of the greenest cities in Europe. So as you will see, it was a little bit difficult to find any particular patterns, but it was a start. So we used existing available data on the health variables and social variables among a population of children, 5 to 6 years, and yeah, it was from those mandatory medical checkups they have in Berlin. And you see the health variables were overweight, dental problems, language deficits, and also delayed visomotoric development. And social variables, parents' social status index, in which is included education, graduation from education, and current employment status. Other social indicators are single parent household, non-German background, and immunization coverage, and the participation in the National Health Check-up U8. Then socio-environmental variables that were also included in the data were the kindergarten attendance, smoking at home, and whether the child had a TV of its own or not. Right, so we linked this data to land use data, which we got from local, the Berlin Environmental Atlas, and in those GIS layers we had access to population density and simple residential versus affluent residential. That is a local definition in Berlin between different areas of different resources. So simple residential is the less affluent area. Then obviously we included the distance to green spaces, making it a factor of less than 300 meters distance to more than 2 hectares size of a green area. And also within the areas we were looking at, the percentage of green space area and then the per capita area of green space. Yes, because we had the population data at aggregated levels of 60 sub-districts in Berlin, so it was within those census areas that we looked at the percentage, for example. Right, and then we made correlations between these different variables, 17 variables, and we found actually correlations between all of those, which were kind of expected. And so then we made a factor analysis to see which one, so we didn't have so many different variables when we then made this hierarchical cluster analysis on the spatial scale. And found that the 4 kind of major loading, we took only the strongest variable within the factor analysis were overweight on single parent household, and then also actually percentage of natural space within the census area and the complete measles immunization. Yes, as said, Berlin was not the best case because it is very green. So as you see also in the areas where we have high levels of overweight, there is also a lot of green space. Although we found a correlation between, what was it again? But it's not even here, but it's the diabetes and access to green spaces. And another thing that was interesting was that the complete measles immunization was actually higher in those areas that were less affluent, while it was lower in the more affluent areas, obviously, which was a little bit counteracting our hypothesis, contradictory to our hypothesis, but we could speculate around the reason for that, and it could be that more educated parents have better access to media and read these flawed reports on the negative effects of immunization, which do not exist. And that is, of course, another reason, another issue, because if the affluent population decrease their vaccination of their kids, we could get an increase in measles epidemics again, which then can have harmful effects on those that are less affluent, and we increase the inequalities even more. All right. Okay. So those would relate to more cultural ecosystem services, potentially. So now we go into the biodiversity, which is kind of the fundament for the basics for all ecosystem services, the regulating ecosystem services, which is kind of the fundament for all human living and our health and the thriving. Right, I think I need to skip this one because I see that time is passing as usual. But I was starting a little bit late, right?
We were starting a little bit late.
Okay, so I get 5 more minutes now.
Okay.
Yeah. So then I can tell you that one of the potential hypothetical pathways between access to natural spaces and health is the so-called hygiene hypothesis. It was Graham Rook who founded that idea, where he started thinking about reasons for the increase of autoimmune diseases in populations, and he relates that to decreased exposure to biodiversity to microbiota, because our immune system is boosted by the gut microbiota, for example. But obviously, then the gut needs inputs of different bacteria and microorganisms, and that we get through our mother and our relatives, siblings, etc. But also through exposure to biodiverse natural environments. And if you think that the biodiversity is in general decreasing, plus we disconnect more from nature as we live in urban areas where the more and more sterile, I would say, then we decrease this exposure, which will not then make our immune system develop in the way it's supposed to do. I have not worked on this myself, so I'm just referring to the work by Graham Rook and other colleagues. It's an interesting hypothesis, though, and yeah, you include that in your project, don't you? Yeah. Looking forward to that. This was another blurry picture. It's about the ecosystem services. I'm sure you know all about that. Anyhow, it is just showing that in the bottom line we have the biodiversity, which is obviously supporting life on Earth, or is kind of a prerequisite for life on Earth, also for human beings. And then we have the different provisioning, which might not be that important in the developed part of the world, but regulating is obviously climate regulation, flood regulation, etc. And then I talked about the cultural ones. This is a picture of how urban trees, urban street trees, and on the city scale, how green spaces can contribute to the ecosystem services and the health effects in cities. most of this research is done within the environmental sector, and what I would like to see is, of course, to link this up to population health, because much of the research on this shows, for example, that trees can deposit particulates, air pollution, etc. But then to take the next step to the effect on the health of that, it's not much done yet on that. So this is one of the potentials where I want all master students to come to me and help me with that. Right, I just listed so you can see these are all the popping up every day, more and more studies on this. Okay. Air pollution is something I should not even mention in this room, since everybody knows everything about air pollution except I. Anyhow, I'll do an attempt to talk about just the prevention of air pollution from green spaces. As you can imagine, the best we can do is to use our cars less. That will have, and this is not, as I said, this is neither on the health effects actually, but this is on cost efficiency of different factors of how to decrease air pollution within a city. So this is all in US dollars. So that the most efficient you can do in terms of economy is to reduce cars. However, the second best you can do is to invest in trees, shrubs, high trees and shrubs, and you can see all down here is all green related, environmentally green environments related decreases in the costs that are connected to air pollution, which is an interesting study, I think, but it would be wonderful to link it to population data, health data as well. Something that I've been working with a little bit, and which I want to continue working with, is the heat prevention effect of green spaces. Fairly recent paper by Kalkstein and her colleagues showed that in the District of Columbia, by increasing the urban vegetation coverage with 10%, you could get a 7% reduction in mortality, heat-related mortality. So here we have actually an example of this where we can look at the health effects, although this is based on all on modeling and scenario analysis. And then it was a study from Australia, where I just found it interesting because they say this thing in the conclusion that the average, because this is a very much different kind of models where they look at use retrospective data and relate the increase in mortality due to different heat increase, temperature increases, and then extrapolate that into the future and what happens within different green space scenarios. And then they say that within this modeling they can't find that there will be much difference depending on climate change. However, we could kind of assume that climate change will not have an impact on health, but most probably it will also have an impact on the vegetation and the trees. You can see in Vancouver after this dry summer, many of the trees are suffering, which would then obviously have an impact on the heat reducing potential. So this tiny little case study which we made in Lund last summer, where we did this direct heat monitoring in different 4 different categories of land cover. So we looked at a park area, a very dense built-up area, a semi-dense, and a residential. And then we used the iTree Canopy tool. It's a software which is online and you can use it. The Canopy is the most basic version, and we used that for this case study as it was mostly an attempt to look at this method with the direct monitoring of heat with loggers. So anyhow, we found is that obviously in the dense area it was mostly built up as compared to, for example, in the park area where we had the majority of the trees and green space. We found also in Lund, you know, this is a temperate climate, so it's even worse than Vancouver, I would say. Well, it's not. We are not suffering very much from heat or yet heat-related mortality. Although we know with the climate change scenarios that will probably become an issue also there. Anyhow, we used the wet bulb globe temperature to look at the effects on health. That can also be discussed why we used the wet bulb globe temperature instead of the UTCI, but it's a long story. But yeah, we were, from start, initially we were interested in working populations in hotter climates, and then this was supposed to be just a pilot. And now this is where we are right now. And we can see that in the dense area there's obviously a higher level of, it's hotter, as measured by the wet bulb globe temperature. It has a higher impact on the human function. This was outdoors, and indoors, interestingly enough, the others, there were no significant difference between those. There was a significantly cooler indoors in the park area as compared to the other areas, which is also interesting because, you know, as I said, I was to this conference last week where they talked about adaptation and that we don't need to worry about climate change and global warming because we will have adaptation to the heat, such as air cooling, air conditioning, etc. I didn't get a chance, unfortunately, to ask what are the thoughts about outdoor workers, for example. What are the thoughts about the increased emissions if we increase the air conditioning, and also about physiological thresholds of human capacity for adaptation. Yeah, that's about that. This was just because, oh no, she left. Yeah, I think I have to skip this one. Yeah, it's just about that. There are one or two studies about the automatic effect on human behavior on our exposure that will just automatically have an effect on our behavior, and it could potentially. Why do I always do this? I say I shall not talk about it. No, I will not talk about it. So this is a summary. Health risk factors which are mediated by exposure to green spaces and nature and the potential health outcomes. This is coming from a report that will soon be published by the Climate Change and Health Bureau of Canada. And it's Sharon Lamb who has been leading that work, and I was working as a reviewer of the report. There are many of these tables and summaries. This one is interesting because we have looked particularly at the Canadian context. So this has been mostly based on research that is already done in Canada on the risk factors that are connected to green spaces and also at the health outcomes. You will find it in the report when it's published. Similarly, Sharon Lamb also made this sweet, nice, didactic model of the urban forest benefits. This one was particularly looking at urban forests, not the other kind of natural areas that we could talk about. And what I particularly like, of course, is that it has in the top of the tree the biological diversity, because it should be either on the top or in the base is the very ground for all of the other benefits of green spaces. As said, this is one out of many. There are many different conceptual models, and I am not skilled, I'm not clever enough to use conceptual models. I was very happy because last week as well I talked to Laura Fleming, a very nice professor from England, or she's from the US but she works in England, and she admitted that neither her understand conceptual models. This is easy enough. So if you're like I and Laura Fleming, please go to this report and you will be interested. You will find something easy. Estimating green space exposure and benefits for cumulative risk assessment applications that you can also find online in the Environmental Protection Agency of US report that was published previously this year, where we looked at how we could incorporate green spaces in health and environmental impact assessments. This is taking us a little bit to the track of policy, where I find where I have a particular interest. I was also working with UNEP, the UN Environmental Programme, on the Global Environmental Outlook #6, and it's global, but I was on the pan-European part of it, where I wrote together with a few colleagues the Healthy Planet, Healthy People chapter of that report. And it's interesting with the main messages in that. The interesting thing with this one is that it's obviously from the UN Environmental Programme rather than WHO, which is the UN Health Organization, obviously. But the interesting thing is that also here within more policy policy approaches, you start to see the interlinkages, the incorporation of health issues with environmental issues. And again, I was part of the author team, so you can see also here somewhere at least we have got the green urban environments incorporated in this report. But it doesn't matter. I mean, you can all see that we need to, it's on ecosystem resilience, etc. And the cost of ecosystems, much of our human development gains, etc. I'm getting stressed. This is again talking to students, master students, because there are loads of uncertainties within this field. We don't know enough. We don't know, for example, the difference between different populations, the perception of nature, how it affects health. It's rarely we can quantify the effects and the interaction effects between different health outcomes, etc. These are other topics for you all to choose and pick and come to me on different topics you can look into. For example, what size would be the best for stress reduction, physical activity, or social inequalities, etc. Those response curves, etc. Mechanisms, physiological mechanisms is something we need to look in very much more. And yeah, many different things to help me with. Epigenetic mechanisms, that happens to be a core interest, so I put it in the middle, and Hind is also working on a very interesting project there, so I'm going to attack you. Right, what can we do about all these uncertainties? Again, relating to this comments that we shouldn't do anything because we're not absolutely certain, which, as you may guess, is not my idea. I kind of think that we should create a better world for nothing, even if we don't have the evidence. I written a paper together with my colleague Martin Ebenhuisen, and we kind of reviewed the reasons for why science is not brought to policy and action, and found a few different factors there, such as the cognitive bias, meaning that we tend to believe what is normative, what other people believe, and what we are told. So therefore, this is need to kind of work stronger on communication. And the last topic there, the evidence-based decisions, is a little bit of a provocative thing, but it might be within this complex world we live, the complexity of the issues, of the challenges, we might need to look at different kinds of ways to create evidence. We might not always be able to rely on randomized controlled trials, for example. And our conclusion was also after this review that the probability for net benefits of green spaces and urban green ecosystems are, the probability for that is very, very high as compared to the probability of harmful effects such as pollen exposure, for example. Yes, this is the last slide. Tony McMichael, the climate change guru, who unfortunately died last year, wrote a chapter in a book that I'm editing on nature and public health, and he expressed it beautifully, the potential approach we need to use as in response to the increasing complexity, the systemic changes, the systemic needs, and the kind of systemic science and solutions which I believe we need to look into. So I'm going to read it. The assessment of risks to human health from the systemic changes in and disruptions to the main components of the Earth systems is necessarily of a qualitative or model semi-quantitative kind. Interlinkages, interactions are complex. And if that frustrates public interest and the conventional needs of policymakers, it is because we carry a simplified, inadequate model of science in our heads that would relate to the potential need for changing views on evidence-based science and decisions. That mental model is the legacy of over 3 centuries of primarily experimental and reductionist research into specific physical and chemical relationships. The ghosts of Francis Bacon, René Descartes, Robert Hooke, and Isaac Newton still pervade our laboratories and journal editorial offices. This is something I want to discuss with you in environmental and public health sciences, and how we can approach these topics in innovative ways to create a better world. Thank you for your attention.
All right. Yes. Okay. Thank you very much for kicking us off this academic season of the OEH Seminar. We are going to open the floor up to questions now. So if you have a question, please raise your hand, and I'll pass the mic along to you so you can ask it to our lovely presenter.
Thanks, Matilda. That was a fascinating way to kick off the year. I'm wondering the extent to which you've seen cultural and population demographic factors taken into account in the development of urban green space indicators. So for instance, here in Vancouver, we use a 400-meter distance for walkable parks, which may just reflect this kind of difference between the European and Canadian context. But that 400 meters is also not taking into account people with small children or disabilities or older adults. So I'm just wondering where we are in that process.
Thank you for that question, because that is, for example, relating to this urban green space indicator that we made for Europe, and 300 or 400 meters. It also depends on how you measure it, as you know, if you do it with Euclidean distance or take the network, road network into account and actual access. There's not enough work done on that. We know exactly, as you say, for example, children, elderly, disabled people would not benefit to the same extent. I mean, it all depends, and that is, again, talking about these uncertainties. There's so many factors to take into account, and that is kind of also why I wrote that paper on Green the Cities Now, whatsoever, because we can't wait really for it's super interesting from an academic perspective to look at the distance and when we can find thresholds to health outcomes and when people will actually access it. But while waiting for that, I suggest that we green the cities anyhow, and then we improve the chances to increase the chances for good research. It's not much done.
Hi, Matilda. You mentioned noise as one of the stresses and then referred to noise in urban environments. Have you considered noise in rural environments as well? We've looked at First Nations in Northeast BC, and one of the things that they really emphasised in terms of cumulative impacts of development was noise. And these are about as rural as you can get. Prophet River, for example, is wilderness area.
No, that's very, very interesting, and that's also one of the things that we need to look more into, urban and rural differences. It's mostly done on urban areas and urban populations in the name of increasing urbanization, but we obviously have still kind of 20% in some areas which are still rural, and particularly First Nations is, in terms of green spaces, but it's not so much done on that thing. And noise in general, the green spaces they have mostly, as I wrote, noise perception is rather than the physiological effects of noise. So that is a very interesting topic. Thanks. Oh, Cecil, we can take this at home.
I'm actually going to ask you maybe a difficult question.
Well, thanks, dear.
I think it's really great to see that this research is coming into the policy, like UNEP and so and so. But to play the devil's advocate, you say, green our cities immediately, do it now, make them greener, etc. And New York and other cities are doing that, planting millions of trees. But of course, then a lot of people criticize it and say, hey, but it's not about quantity, it's about quality. So, and we know very little still about what types of green space has effect on specific health outputs and so on. What's your impression of that? You say green the cities as much as possible, or do you have a bit more nuanced approach to that?
No, well, yes. Thanks for making me clarify that, because that was a little, I mentioned it briefly when talking about the urban green space indicator, because that one is related to public green spaces and does not, for example, include the private and cemeteries, etc. So what I would say is that, yeah, for sure, the quality matters for some of the health outcomes. It's important for probably stress reduction, though for the heat reduction, for example, and the air pollution dispersion, I wouldn't say that the quality is as such matter very much, but then it's just vegetation whatsoever. And we don't know whether it's the stress reduction effect or the heat reducing effect, or most probably the interaction of those that has a final outcome on mortality. So in general, I stand by the green the cities now because of the probable interaction effects. I lost what I was going to say. It was very clever. I don't think we will ever be able to kind of nail exactly that this quality, this particular pattern of this leaf has an outcome of reduction in cortisol with 0.7. I believe that we can find that there is a decreased mortality. I think that might be the level we can reach. Mortality determined by stress, physical activity, heat reduction, etc. We can try, of course, or we will, fractionize that and look at the different things. But
All right. So thank you very much, everyone, for.
I think we're out of time.
Yeah,
So
we're out of time.
for time's sake, we're gonna end the session now. We're a little bit over 1:30. But if we can all please give another hand to Dr.